Let's see the infection chain. These are the components of infection chain. Let's see one by one. The first one, causative agent. The invading organism, for example, bacteria, virus, fungi are called causative agents. Next in chain is reservoir, the environment in which the invading organisms live and multiply. Next is the portal of exit, the mode of escape from reservoir. Example, respiratory tract, gastrointestinal tract, etc. Next in chain is mode of transmission, the method by which invading organism is transported to a new host. For example, direct contact, air, by food. Next in the chain, portal of entry, means by which organisms enters new host. Example, respiratory tract, gastrointestinal tract, and broken skin, etc. Next is susceptible host. Susceptibility is determined by factors such as number of invading organisms, duration of exposure, age, state of health, nutritional status, etc. So these are the chains of infection. Now, let's see some important terminologies related to infection control. Asepsis, freedom from infection or prevention of contact with microorganisms. Antiseptic, an agent that will inhibit the growth and development of microorganisms without necessarily killing them. Bacteriostat, an agent that inhibits the growth of bacteria. Bacteriostasis, it is a state in which bacterial growth is prevented without necessarily killing them. Bactericide, an agent that has the power to kill microorganisms. Culture, process of growth of microorganisms or other living cells using a culture medium. Contamination, act of soiling or making impure by contact. Cross infection, infection transmitted between individuals infected with different pathogenic organisms. Carrier, a person who harbors the pathogenic organisms without showing the symptom and signs of particular disease. Colonization, microorganisms invade a host, grow and multiply but do not cause infection or disease. Disinfection, destroying of all the pathogenic organisms. Concurrent disinfection, immediate disinfection of all contaminated articles and bodily discharges during a disease course. Terminal disinfection, the disinfection of the client's unit at the end with all articles used by the client upon discharge or death or release from isolation. Disinfectant, an agent which kills the microorganism or the organisms. Droplet infection, infection of the individuals by fine particles of saliva and mucus that are expelled from mouth and nose of another person during coughing or sneezing or speaking. Fomite, objects that have been in contact with a contagious disease and are capable of transmitting that disease. Infection, the entry and multiplication of a disease producing agent in the body. Nosocomial infection or hospital acquired infection, the client develops an infection that was not present or was incubating at the time of admission to the hospital. Quarantine, isolation of all well persons who have come in contact with an infectious disease for a period of time which is equal to the longest incubation period of that particular disease. Isolation, separation of infected persons from the non-infected persons for the period of communicability under conditions which will prevent the transmission of infection to others. Sepsis, infection of the body by pus-forming bacteria. Transmission, transfer of disease from one person to another. Sterilization, destruction of all microorganisms, pathogenic and non-pathogenic, including their spores. Autoclaving, process of sterilization of articles by steam under pressure using an autoclave. Immunization, act of creating immunity artificially against a particular disease. So for more MCQ related to infection control, you can click the link above and you will get the MCQ with the answers. Hi, if you find the video useful, please like, share, and subscribe the channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.